Good morning, and welcome to the third annual symposium of the Jameel Institute. It's 3 years since we were founded, and I'll start off by running through a few slides outlining the history of the Institute and introducing our speakers before handing over to the first session. So the Jameel Institute was founded in the nick of time before the pandemic, with 6 initial academic staff and a generous donation from Community Jameel. By January 2020, of course, we had reports of a novel coronavirus in Wuhan, China. During that first few months of the pandemic, we recruited a number of staff and stood up what became known as the Imperial COVID response team, which ended up including some 70 to 80 staff at Imperial College altogether. And that continued really through to the beginning of 2022. In the last few months, we've been transitioning from pandemic response mode to thinking more strategically about the future, returning to our strategic themes for the Institute, and with a greater focus on thinking to the future and pandemic preparedness. And so it's I'm very pleased to be able to announce that my colleague Katharina Hauck has just founded what we call the Jameel Institute and Kenneth C. Griffin Economics of Pandemic Preparedness Initiative, which was announced about a month ago. This is funded by a major donation from both Community Jameel and the Kenneth C. Griffin philanthropic organisation to undertake work on scientific development of methods for integrated preparedness and response to pandemics, integrating both epidemiology and an understanding of the impacts of control measures on the economy, capacity building work in integrated modelling, preparing country-specific case studies, and preparing an online dashboard for pandemic preparedness, which can be rolled out across multiple countries. And it involves close working relationships with the Prepare Initiative in Singapore, but also with the World Health Organization globally. Turning to today's symposium, a great range of speakers, and we have 3 sessions, and we're exploring here the interface between epidemiology, pandemic preparedness and response, and behavioural and economic sciences. So in the first session, we're looking at the economics of pandemic preparedness, where Katharina Hauck will be joined by Andrew Burns from the World Bank, Günter Kraut from Munich Re, and Professor Tim Hallett from the Institute itself. That will be then followed by a session on behavioural interventions and their impact during a pandemic, and the effect really of population behaviour on responses to a pandemic, where my colleague Marissa Moraldo from the Imperial College Business School will be joined by Dame Teresa Marto from Cambridge University, Matteo Galizzi from London School of Economics, and Rafael Calvo from Imperial College. And then finally, we will have a session on something which was really highlighted by this pandemic, both within countries and globally, namely looking at inequality during a pandemic and the impact of that, where my colleague Nimpathy will be joined by Indrani Gupta from the Institute of Economic Growth in Delhi, Dr. Mark Blecher from the National Treasury of South Africa, and Dr. Tonatiuh Gutierrez from the National Institute of Public Health in Mexico. So as we celebrate our 3rd anniversary, I'd like to also take this opportunity to really thank Community Jameel for their consistent support for the Institute and interest in it, and the many opportunities they've made available to staff of the Institute and more generally across, I should say, Imperial College to deliver our best. So I'm going to hand over now to Professor Katharina Hauck to open our first session and enjoy the symposium.
Thank you, Neil. Yes, so after this introduction from Neil, I'm very happy to be able to join the first session of this symposium on the economics of pandemic preparedness, timely as we are embarking on this exciting new stream of work at the Jameel Institute that Neil just mentioned. So we have a super exciting lineup of speakers for this session. Can I just start with a few housekeeping remarks? There will be a short 10-minute break in between the sessions. Please do remain online and don't log off. The event will begin after that break. The symposium is being recorded and will be available on our YouTube channel after the event. And we would really love to hear from you during the session. So please pose your questions in the QA box that you find on top. If you want to remain anonymous, you can do so, but please hit the anonymous button before you pose your questions. And please do remember to vote for the questions that you want to be answered by the panel, because that will be, votes will bump up the questions in the list. So let me dive straight in. Our first presenter and panelist is Dr. Andrew Burns. He's the World Bank's global lead for macroeconomic modeling. Previously, he worked as a manager and lead author of the World Bank's Global Economic Prospects Report. And before joining the World Bank, Andrew was with the OECD and the Economic Council of Canada. His focus in recent years has been on the macroeconomics modeling across different studies estimating the effect of COVID, Ebola, and avian influenza on the economics of developing countries. Andrew holds degrees from the University of Manitoba and McGill University in Canada. So over to you, Andrew. We're excited to hear your presentation.
Great, thanks, Katharina, and thanks so much for the opportunity to be here. What I thought as a macroeconomist I might do is really just speak to sort of how we look at events like a pandemic or like Ebola, and just sort of share some of the views that we get when we do that exercise. And I think it's useful when we think about the economic impacts of a pandemic to think about or distinguish between the initial impacts, the sort of adjustment phase, and then the long run effects. The initial effects are really very much sort of, oh my heavens, we have a pandemic going on. We see a lot of avoidance behavior. Initially, that is going to be more what people are doing just quite naturally as they recognize that the risk of infection is growing and that this could have serious impacts for their health. And then, of course, we have the regulatory induced changes in behavior as various public health measures are put into place. We've also got happening, and that's really important from an economic point of view, is the impact of uncertainty, particularly as it affects firms. They're uncertain how this pandemic is going to roll out. What's that going to mean for their business going forward? And typically that generates a very large reduction and rapid reduction in investment, which will have important knock-on effects for the economy. And then, of course, we've got the initial epidemiological effects. So we have increases in deaths, hospitalizations, people getting caught. Well, those are certainly what's grabbing our attention and driving the other factors that I described. They're not necessarily the ones that are having the most important economic effects. As we move to the adjustment phase, people start to adjust to living in a pandemic. Firms begin to offer new products, to organize themselves differently. And of course, we're kind of living this in this the Zoom world that we are in now, very much a new way of doing business. Individuals' behaviors adjust also. People stop necessarily going directly to the shopping centers, for example, and instead have food and other goods delivered. And then we, of course, begin to have the public sector policies kicking in. subsidies to firms to help them deal with the reduction in demand, additional unemployment insurance mechanisms being put into place, demand stimulus efforts to try and mute the impacts on the economy. And then as we shift into the long run, we've got a different world also. There we're sort of having to deal with the pandemic as a part of the new normal, sort of more of an endemic rather than pandemic event. We've got important structural changes that occur in the economy. Premature and permanent closing of some businesses that were failing but might have survived longer before, changes in the way of doing business, early retirement of workers who realized, during the pandemic, I wasn't working and I actually figured out how to make that work, the continue of that. And then an expansion of low contact businesses that occurred during the pandemic and then continues. So with that, we also have permanent effects on productivity, human capital formation, children having been out of school for 2 years or having had their schooling interrupted, that might have long-term impacts on productivity. So we're trying to look at all of these things. And I thought it might be useful just to share what that might look like in the data. And so what I have here is GDP data for the United States running from 2015 to 2022. The red line is showing us what occurred historically. And then beyond sort of the beginning of 2020 is just a naive forecast of what that might be if the growth rate had continued at the same average rate that it had in the preceding 5 years. And you can see the impact of the pandemic quite clearly in the graph. You've got that initial acute impact. As we get that avoidance, we get the uncertainty, people withdrawing from economic activity, very sharp negative impacts. We move into that chronic recovery phase, if you wish, where we're starting to adapt, learning how to live with the pandemic. The new firms and new ways of doing things start to take into effect, and those initial economic impacts are reduced substantially. And then we move into the long run period. Kind of hard to tell exactly what the long run is because the world keeps changing. We have other things intervening, but we have the Ukraine war, for example, or other impacts. But we're moving into that period where the disease is more having its long run effects are being observed. So that's kind of the way we look at it. And if we look at that, so this is the same data as we are observing here, but I've just taken the trend out. And so we're looking at it as a deviation from the trend. And you can see that initial effect was a reduction in activity by about 10%. And then as we moved into the initial phases of that recovery period, that reduction fell to about 5%, and then we're off to this period. If we wanted to sort of get an estimate, and that's what we do as economists of the total effect, well, we would just try and take the integral of that space. That's sort of the total economic cost, or a rough and ready measure of the total economic cost of the pandemic. And we can do that same kind of calculation for a wide number of countries. So here I've got it for Great Britain in green, China in red, and you can see that the initial impact was much more severe in the UK. China, it occurred, as indeed did the disease, more swiftly than it did in the United States, but the long-term impacts have followed a different trajectory. And if I wanted to, I could sort of go and grab the same kind of data for a whole range of countries. And I've done that here for just a broad sampling, some of the major European economies, and then 1 or 2 countries from each of the developing regions. And I think the real takeaway that we want to get from this is how different that costs of COVID have been across countries. You have some, like in the case of Great Britain, where we have very big initial costs. We have others where they were much less pronounced and much quicker to dissipate as the economy recovered. And that's very much about how behavior, how the economy adapts, how the disease interacts with the structure of the economy. And that can be a pretty complicated process that is driving that. And that's really what makes this understanding and devising policy that sort of minimizes both the health effects, but also minimizes the economic effects so very difficult. If we take that same sort of logic, that same graph, and we apply it to the 50 states of the United States, you can see that wide variation of responses is true even within a single country. You have some states which were very sharply affected, and you have others that were much less. You have some states that are having long-term permanent impacts, and other states that have recovered or even growing at above trend as they get past the initial phases of the COVID endemic. So if we take that integral calculation that I talked about before and sort of calculate it up for those initial countries that I was showing you, you get this as sort of the cumulative impact thus far through the second quarter of 2022 of the pandemic. And what's striking here is how different those impacts are. You're going from less than 5% of GDP in the case of Japan to 10 or more percent of GDP in a wide range of countries here, and even as high as 21, 22% of GDP in the United Kingdom. What explains that? It depends. Partly it's the structure of the economy, how important are the various service sectors in the economy, which were probably most hit, high contact areas. How important was or how strong and effective was the policy response in terms of counteracting the fiscal impacts of the disease? And also just how cohesive the population was. How did they respond? Were they able to respond as this is a problem that affects us all and we should try and take steps to reduce disease spread? Or was it something that was a little more individualistic and where those kinds of behaviors that might reduce the severity of the disease were less visible? I think one of the important factors to take out of this is that the disease severity is not really very well correlated. Okay, so what have I got here? I'll come back to that. I wanted to go to this graph first, which is showing us in the orange lines. The blue lines are the same lines as we were looking before, but the orange lines are showing us the intensity of the disease that's experienced by the countries, here being proxied by millions of COVID deaths per million in each country. And so you can see that the countries that had very strong GDP economic impacts weren't necessarily the ones that were reporting very strong or very large amounts of deaths or impact of the disease. And that's really complicates matters very much, I think, as we're looking through epidemic and reducing the economic consequences of COVID, because there is no really strong correlation between the impact of the disease and the impact of GDP. Anyway, I'll stop there. Catherine, thanks so much for your time, and looking forward to the discussion.
Thank you so much, Andrew. That is absolutely fascinating and sets the scene, I think, for what comes next, which is actually first Dr. Günther Kraut, Global Head of Epidemic Risk Solution from Munich Re in Singapore. Günther is an experienced reinsurance professional with a detailed knowledge of both life and non-life insurance products and the risk transformation into investable asset classes. He has been with Munich Re for 14 years, structuring Munich Re's first pandemic risk retrocession program in 2013, And later on, he initiated and co-led the Epidemic Risk Business Innovation Project, which was then transformed into a discrete business. He's a regular speaker at conferences and involved in many public-private partnership discussions around the globe. And he holds a degree in financial mathematics from the Technical University of Munich and a PhD in risk and insurance. Over to you, Günther. We are dying to hear the perspective that you are going to present to us. Thank you.
Thanks, Katharina. And maybe linking to what Andrew said, I mean, of course, the one statement to say the insurance balance sheets are obviously not large enough to cover all of these economic impacts, which Andrew has just described. So I'll try to kind of take you along a little bit into what we can really try to do as an insurance industry with the limits of accumulation potential, with the limits of capacity we can contribute. And Sam, if you would just go to the first slide, because we're wondering what is a good introduction to really provide a outlook to some of the topics. The one first starting point, which we thought might be useful, is how can such insurance products for business interruption impacts look like? And I say business interruption impacts because there are other products which can cover epidemic and pandemic risk. There can be life insurance, life reinsurance transactions. There can be outbreak response cost financing transactions, often for the public sector. But this is really a typical cover as we sell it to the private sector, to an individual corporate. Now, one thing we need to do, and we need to profoundly do, is to define what is actually the insured event. And you are well aware of that is not properly done, as that was unfortunately the case in some of the typical products on the market and some of the property damage products. There were a lot of court cases even to say like, oh, is the virus on the door handle considered a property damage or not? So all these kind of things we should avoid. In most of these policies, it was clearly excluded, but somewhere in the gray area. In a way, the job is easier here because here, this is a product designed for clearly intending to cover precisely such events. However, the large-scale events, so we still need to differentiate from, say, Legionella in the water system of a hotel, which is a localized hygiene problem. So if you think about it as an epidemic cut cover, one way of doing it is simply to say, well, first there needs to be an event. That might be the first report of the disease of an outbreak by the WHO, the so-called disease outbreak news, 5th of January for COVID. Then it might be the announcement that this is actually a large outbreak, because there are many small outbreaks happening all the time. So the public health emergency of international concern would serve the purpose as being the highest alert level under the international health regulations that was declared end of January 2020 for COVID. And thirdly, in an insurance product, you want to pin it somehow to the area of insured interest, be it the location of your hotel, of your factory, whatsoever. One way of doing it is simply saying, well, there are civil authority restrictions of some form imposed to respond to the outbreak. That is simply a sign that there is economic damage caused by the outbreak. With such a clear definition, then you can be quite flexible in what is the precise economic KPI you want to ensure. Is it loss of gross profits? Is it extra expenses? Is it debt obligations in the sense of serving a corporate business loan for a certain time period? That can be chosen for the client. And what we typically see with our client discussions, it is important to have a very quick payout, a quick outflow of liquidity, and there are ways of doing that with such a structure in a very quick and simple way. So if you just go into the next slide, just to go a little bit deeper into how can we offer these products, because we often hear, is this risk priceable? Can it be quantified? And actually we think, yes, it can be done quite well. We have the advantage that we started doing so in 2017 already. That's when our dedicated department, Epidemic Risk Solutions, was started, and we started to build up our own pricing model. And there are a lot of historic outbreak events, almost formed like a pyramid. Most of them are small, some turn larger, some turn very large, but there is a good database of historic epidemic outbreak disease activity, so good approaches for actuarial pricing models. And maybe in the far tail end, you can of course use stochastic models to extrapolate. Now the outbreak is the first very important step of pricing. But then of course, in the next steps, you need to see how does it spread across countries? How does it then cause economic damage? Not all outbreaks spreading far are causing the same degree of economic damage. Coronaviruses are likely to cause a different type of damage than monkeypox, for example, to name the most recent public health emergencies of international concerns. Of course, we need to look at how it's reflected in policy triggers and apply the typical concepts of insurance policy design. Looking on to the next slide, though, if I say the pricing is not the problem, the big problem of insurability is really the accumulation risk potential, the complete breakdown of diversification, right? Usually insurance relies on if an earthquake happens in California, then most likely not in the same year in Tokyo. So that is where we can spread the risk across the globe. And while that may be the case for regional outbreaks like Ebola and SARS, in a pandemic scenario, this obviously breaks down. And that also means that the concept of insurance, the base of the business model of insurance, fundamentally breaks down. So while the left-hand side of this chart really illustrating a typical value chain is the traditional insurance value chain. You have protected companies, insureds, you have primary insurers offering the covers, and you have maybe the reinsurer standing behind, spreading the risk across the globe a bit further. The big problem is each insurance company now will have a very, very limited amount of capacity they can deploy on such systemic risks, on such accumulation risks. So the only way to make it more insurable is we need to bring in many more shoulders to help carry the risk. And first and foremost, to name the capital markets. The capital markets at large have much deeper pockets than the insurance industry alone. And of course, we need to consider the public sector, because given the magnitude of economic losses caused by COVID, the private sector, even with the larger capital markets, can accommodate ultimately covers for a certain share of the risk, but not for all of the losses. So if we really want to scale up to make economies more resilient, we need to think about how to combine both private and public sector funds. That was talking a lot about bringing in more capacity, more market size, and that's the supply side. But another hurdle for market development is the demand side, because given the massively increased risk of epidemic and pandemic outbreaks over the last decades, talking really about percentages per year, also these covers will be much more expensive than a fire insurance policy because the expected loss is higher. And one way of addressing that, if we don't want to call for subsidies, is really combining different financial instruments, such as insurance and contingent lending, for example. We can dive deeper a bit later, but one outlook I would still like to give in the opening remarks on the next slide. Such a concept described as an epidemic risk markets platform, as a specialty market approach, has actually been recommended and both also endorsed to the APEC finance ministers. Next week we have the APEC summit in Bangkok. Thailand is the chair. And so that is really an initiative which has been vetted, which has been accepted. And reasons for that on the last slide I'll have with me today is simply, why is this an attractive value proposition for the public sector to also support such a market development? Just to highlight, there are no subsidies required. We can address affordability by combining different financial instruments. And very important, looking at ex post versus ex ante, we can use existing infrastructure and we can really send the right signals for preparedness and the right incentives for taking steps for risk management. With that, I'll stop here. I know the slides contain more words, but they may be shared afterwards. I just wanted to use them really as an opening introduction to the topic.
Thank you so much, Gunther, for this absolutely fascinating perspective that we often don't see as academics working on the epidemiological and economic side. So thank you so much for that. I now pass for our third speaker before we open this all up for discussion and questions, which is Professor Timothy Hallett, who is here as a Professor of Global Health at the Jameel Institute of Imperial College London. He is the Associate Director of the MRC Center for Global Infectious Disease Analysis and also lead investigator at the Jameel Institute. His main research interests are the epidemiology of HIV, HBV, and HCV and TB diseases globally. And also, and I think that will be very interesting for us, understanding how resources are available for healthcare systems and how can they be used to have greatest health gains for populations, both in endemic and pandemic settings. He has formally founded and directed the HIV Modeling Consortium and chaired the UNAIDS reference group on estimates, modeling, and projections. And he's also an affiliate professor in Washington and chair of the modeling guidance group of the Global Fund and a fellow of the Academy of Medical Sciences. Thank you so much, Tim, for joining. If we could get your opening remarks.
Great, thanks very much. The invitation to be here. Two fantastic talks already. So what I wanted to throw into the mix on the question of the economics of pandemic preparedness was just to point out that this has a very strong overlap, I think, with the concept of healthcare system strengthening. More than that, the paradigm of healthcare system strengthening is broader and encompasses being resilient to many threats besides pandemics, shocks that might be caused by climatic events or population displacements or other kinds of acute stress, as well as it having its objective of improving health overall, however that's defined. So there seem to be many things that people talk about as being badged under pandemic preparedness and the economics of pandemic preparedness that would also be helping to strengthen the healthcare system. So any discussion of pandemic preparedness and the economics of pandemic preparedness seems to need to be linked closely to the concepts of healthcare system strengthening overall. I would hypothesize that this means that we need to get better at recognizing the benefits of investments in healthcare system strengthening and the linkage to pandemic preparedness, and that also when we're thinking about how to reform healthcare systems, we should very much be thinking not about how they operate under sort of normal conditions, but how they are resilient to particular challenges. And maybe there's two more hypotheses that flow from that there are risks of not taking this approach. There could be a risk of missing opportunities to make system, if we're focusing on making systems resilient to pandemics, do we miss opportunities to make them resilient to all other kinds of stresses and challenges that they're going to face? And if we focus on pandemic preparedness without thinking about it within its wider context, do we risk compromising the achievement of other objectives of the healthcare system, such as efficiency and universality and equity in improving the health of the populations they serve? So those are just my hypotheses for now, and I think they serve to generate some interesting questions. So, I mean, just to take a real step back, public health security has always been about minimizing the impact of acute public health events that endanger people's lives. I think people would recognize that it's pandemics and other types of emergencies and weakened health systems that together pose the greatest risk to population health and, by extension, economies. So I think we need to keep the paradigm about investing for strong and resilient healthcare systems. I think that's true everywhere, actually, but I think it's especially true in low-income settings. So let me bring attention to those. I mean, in those settings, healthcare systems are weak, fragile, and stretched. But also they are undergoing reform, and which are really important reforms that could underpin the contribution to health in those populations for future years and decades. And also in these settings, the lowest income settings with the most fragile healthcare systems might be the ones which are most exposed to risks of shocks and stresses in the coming years. It's always been hard to talk about the economic case for investing in healthcare systems because the benefits are distributed over many different persons, over many different outcomes, and over long periods of time. As a result, it's been hard to assess where the money, whether more money should go into this area, how much more money is enough to make a difference, and where it should go. And I think the questions of pandemic preparedness are going to run into those same questions. I mean, but steps are being taken. There is now work coming through which shows how alleviating some of the problems in a healthcare system can translate into real health gains. So, work I've seen which looks at how reducing the risk of stockouts of medicines translates into much improved patient outcomes, how improvement of key healthcare worker cadre can reduce bottlenecks and lead to healthcare service delivery targets being met. Relatively small investments having oversized large benefits. So anyway, there does seem a lot of overlap between investments that people talk about for pandemic preparedness, and we're going to talk about more in the discussion, I think, and healthcare system strengthening. The strong healthcare systems are the ones best able to cope with the challenges, the facilities with staff and each cadre and robust supply of water, electricity and oxygen and other medicines are the ones which are going to cope best. And preparation for outbreaks or pandemics will also strengthen the healthcare system and improve care when there is no such emergency. So if we're going to improve medical record keeping and surveillance and increase the capacity of community healthcare workers or improve supply chains, that's going to be very useful in peacetime as well. Fundamentally, what's needed, all round, is robust community and primary healthcare services close to where people live and accessible to all. The disruptions, I would say, in core services and health losses that we saw during the COVID pandemic, especially in low-income settings, would have resulted in large health losses in addition to what the COVID pandemic itself exerted. But these would be health losses that were in some sense avoidable if there had been more general resilience. And there are lots of anecdotes, we can go into them later on, about the countries which had the history of the strong public health system faring better in COVID, and maybe that's one of the things which helps explain the graph that Andrew showed earlier on about the sort of lack of correlation between the GDP impact and the health impact of COVID. So look, I'll finish, but I'm just suggesting that it's useful to take a step back and think about pandemic preparedness and the economics of pandemic preparedness as one objective among many of investments in public healthcare systems. And I think it's going to be important to think carefully about how these different objectives sit together. Can we think about pandemic preparedness as one facet of strong and resilient healthcare systems? To what extent are the investments that help achieve pandemic preparedness the same or different to those that we need to achieve a resilience to other types of challenge? What kinds of change help achieve more resilience actually? And what level of investment is needed to achieve meaningfully better outcomes for patients? And if these 2 to 3 concepts of pandemic preparedness, generalized resilience, and healthcare system strengthening are not perfectly aligned, well then what priority should be placed on one or other of them in the face of so many other competing demands in these healthcare systems of low-income countries? And to what extent would making the wrong choice or a different choice compromise different objectives that would be held as important by those populations, like efficiency and equity? Okay, thank you very much for the time. Back to Katharina.
Thank you so much, Tim. I think that leads us really nicely to a discussion of next steps. How are we actually going to structure investments into pandemic preparedness? What do we need to consider? What kind of research? Before I open up for the discussion, there is a question posed by Anonymous, which I think is a question of understanding. For your study, Andrew, I saw one you have answered already, but there's another one posted by Anonymous. For the calculation of correlation between disease and economic impacts, did you merely use reported COVID-19 deaths or some estimate considering the undetected cases?
Yes, thanks, Katharina. We used just the sort of the reported COVID deaths from the Johns Hopkins data set, from the CSSE data set.
Thank you. Thank you, that's great. So why don't we start straight out with the questions actually posed by Tim, which is something pandemics are a 100-year event, right? And the associated risks are unquantifiable. Why should we be investing in pandemic preparedness? Is there a strong business case? Is the return on investment into pandemic preparedness always necessarily positive? Who wants to start this, answering this epic question?
I could maybe pick up one part of it, because I always don't like to hear 100-year risk only we need to be concerned about. And on all levels, I should say, no matter if we talk to corporate clients, to primary insurers, or to governments, this education about how dramatically the risk has changed is always still key, is always still important. And there are many ways of why that has happened, right? Much of it to do with our way, how the human population interacts with the animal populations. We cut down rainforests, then the animal population in the remaining forest is out of balance. You have no predators, hence you have more bats, to take one of the example. More bats on a dense area is more viruses circulating. So you see where that argument is going. Other prime prototype scenarios, other way of farming, 10,000s of chicken, of pigs close together, birds flying over it and dropping their remains into that stable. But if you want to give simple numbers to it to get an intuition why this is really percentages. I mean, if you just take the Spanish flu as the prime example and then COVID-19, both viruses with very similar characteristics, right? Then it's a 1 in 100, a 1% per year chance for another large scale event. But then if you just look at the particular virus class of coronaviruses, then you'll see 3 large scale outbreaks within 17 years. SARS, which also made it to 34 countries, MERS, and then COVID. And as a mathematician, I would say, not in the 17 years before, and not in the 34 years before. So you really see very easily something has changed with that risk. And that puts you clearly higher. And leave it to the risk models, if it's 2, 3, or 4%. Sorry, someone seems to have switched off the master switch. I probably need to step out and switch on the light again. But that is clearly, with that change in risk environment, we almost have to think about better ways to manage the next one if we are unhappy with the way we responded to this one.
Thanks, Günther. That's interesting. Any other comments that Andrew or Tim, you want to add to this question of why we need to invest in pandemic preparedness?
I think maybe I can take a try at that. One of the slides I skipped over, and if you indulge me, I'll try and put it up, was comparing the sort of that naive estimate of the cost of the pandemic against the cost of the great financial crisis of 2008, where the fear was the world's economy was going to completely implode. And I think that is really revealing, because I don't know if you can see it now. You'll see that the COVID losses calculated in that way just outstripped the losses that we were observing in the global financial crisis by a large measure. So I think one of the takeaways that I have from this is that what we know from this kind of pandemic is that it was a really, really, really expensive economic event. It can be measured in this way, but it can also be measured by the increase or the amount of spending that governments did in order to not so much finance the health response, but to counteract the economic response. And so we have 10% of GDP deficits in most of the high-income countries in response to this, increases in debt to GDP ratios that are going to take decades to pay for. And if in some sense it's that delta that is sort of the long run cost of the way we handled it this time. And I think that there's great opportunity through some of the measures that Tim was making to, by having more resilient healthcare systems, by learning from what worked and what didn't work during COVID, to reduce those economic costs.
Yeah. Thanks, Andrew. Tim, you have something to add?
Well, all I would, I mean, to say, I think it's built on the earlier two comments. That of all the things that you would want to include in your basket of things for pandemic preparedness, I think only a very small fraction of them would be sort of like only useful 1 in 100 years. You know, there are lots of, Gunther said there's pandemics and outbreaks will happen more frequently. I agree with that. I think there's also lots of other challenges that will need to be faced, in addition to pandemics, that, the combined frequency of these things is not so low. But also my hypothesis, like I'm saying, is that the things that within that basket, most of the spending would go on things that actually would be used every single day, and particularly in where health systems need to be strengthened anyway, and that would have its value all the time, not just on rare occasions.
Thanks, Tim. But I mean, if you think about what kind of measures are necessary to have a health system continuously prepared for an emergency, wouldn't you need to hold a certain level of spare capacity? I mean, very simple, a certain number of beds, for example, or staff which can be redeployed very fast. How do you calculate actually the amount of spare capacity in the system?
Shall I have a go at that one first? There's lots of different ways of doing it, aren't there? I mean, I think the key thing would be flexibility. The literature focuses on flexibility as one of the key things that's important for resilience. And spare capacity, or maybe it's a little bit of slack in the system, is really helpful. Systems in place that can allow movement of resources around things, but also just stronger systems. If we're good at record keeping and surveillance and supply chains, and we're not completely stretched all the time, then we have the ability to be flexible.
Yeah, great, thank you.
And maybe if I may just add there to what Timothy is saying, I think as a believer in market mechanisms, right, as a steering instrument as well, partly that's how the question should be answered, right? Like if you have a quantification of the risk, if you have a price tag to the risk, that tells you a lot about how much is it worth to spend on preparedness. That's why these incentives are so important. And to a degree, I would almost think, and that's also where I'm interested in the opinion of my co-panelists, I would actually think there is not such a big kind of opposing effect on protecting health and protecting economies. That's quite interesting to observe also from being in Singapore and the discussions we had in other parts of the world. And because often I felt the second order effects are forgotten. Yes, first order effect, if you have lockdown measures, that of course impacts businesses. But being the curse of an epidemiologist, right? If you are effective and early, then the outbreak is small and you will be blamed. Why did you respond so strongly? If you don't do anything, it becomes bad. Then you are blamed. Why didn't you do more? So if you wouldn't do anything, of course, the health impact would be much stronger, also leading to a stronger economic impact, because people wouldn't go out on the street for fear of infection, even if they were allowed to. So in that sense, I would feel these things are actually quite aligned.
Yeah, thank you. Just to move on to a question that Anonymous posed on the chat. what do you see as the limits of insurance, which I guess is a question to Gunther and maybe Andrew as well. And maybe can I add to that? I mean, Gunther, you talked about the accumulation risk that we see when we have a worldwide pandemic where we can't spread risk of the insurance across different countries. And the importance of public-private partnerships, apart from financial markets, to insure against that risk. But we had such an, or had such an instrument, which is the PEF, right? The Pandemic Emergency Financing Facility of the World Bank, which could be interpreted as such a public-private partnership, but has been criticized by many as ineffective in responding and preparing for pandemics. So any idea maybe to Gunther and Andrew, why what we can learn from this public-private partnership?
That's 3 questions in one, Katharina. So I'm just wondering which one to pick for starting.
Easiest, right? Yeah.
So what are the limits of insurance? Maybe in that order. So clearly the amount of capacity provided. I think one part important to understand also for expanding, as I said before, for how could you attract capital markets in the broader sense in, it is actually worthwhile to invest in pandemic risk. Because as a capital markets investor, you actually do increase portfolio diversification. And before you all say, but of course a pandemic will have an effect on capital markets, I'll just counter it right away with the counter argument in the other direction. But a financial crisis like 2008 does not start a pandemic. So you have an increase in diversification. It's from a comparative value perspective, a profitable risk to invest is better rewarded than the same expected loss for credit. And it should be, because it's less liquid. So there are hard economic reasons why financial market participants should come in and have an interest to come in. Does that mean they can come in unlimited? Clearly not, because of that accumulation issue. So each of them will need to define their own risk limit, and that risk limit will be smaller than for other risk factors. So that's why we need to find ways to crowd in as many as possible. And if you look at market size, well, that's of course then a small niche market. You can't cover the whole economy, the whole mass insurance market at once. You need to really start small. And if you want to scale up further, you need to bring in private sector. So that's really the question of how large the market as a solution should come. But that's leading naturally over to the demand side as well. And I think we had that question there as well. What is the right balance between external finance, insurance, and these instruments? Clearly, insuring everything is not economical, because if we talk about percentages of expected loss, a corporate should not cover all of their economic losses. They should buy an amount which helps them to survive the event, maybe, take care of the corporate loan, but it's clearly a small amount, a small first loss limit, as we call it in insurance terminology, to get over the event, but not to cover all impacts. For that, you need to bring in other instruments such as contingent credit and other tools.
Thanks.
That was a long answer to the first one. Andrew, maybe you take it first and then we come back to PEF.
Sure. So I guess I would just emphasize the size of the damage. If you take those naive estimates I presented earlier, we're looking at an event that's 10% of GDP, and insuring against an event of 10% of GDP, if it's once of 100 years and you do very simple math, which would be wrong, that's 1% of GDP a year in insurance costs, right? That's a lot, right? And nobody's going to do that, maybe 0.1%. But we're just not going to do that kind of amount. The second element, I think, is to recognize that there are things that are privately sensible and make sense to insure against. And then there are things where the social costs and the social benefits are greatly differentiated. And I think this is one of those stories where the social benefits of doing the kind of things that Tim's talking about that would reduce the impact of the economic impact of a pandemic far outweigh the cost of insuring against a pandemic of a given size. So if we can reduce the economic impact of a pandemic by 50% by communicating clearly about it, having in place sort of rapid responses that allow us to adapt flexibly, then that's going to be much less expensive than that sort of alternative counterfactual of, well, we'll just let pandemics happen and we'll just, insure ourselves against them so that the economic effect is covered as well as possible. That would be my quick and dirty response.
If Timothy doesn't reply immediately, then I would jump in with the next question on PEF, because Katharina, you added that one. Maybe just for the ones who are not familiar with it. So that was a particular instrument structured in the lead of the World Bank for really outbreak response cost financing. So really to be differentiated from business interruption mechanisms. So this was really for direct financing of response cost. And there was a criticism like, did it pay out too late? Was it too complex? And so on and so forth. But to understand the discussion, I think it's very important to recall the instrument was designed for the so-called IDA countries, so for the least developed countries. So when PEF paid out, that was actually at a point in time when only like 1% of the global cases of COVID were in the IDA countries. That of course led to a perception, hey, why is this facility in place and it doesn't pay out quicker? Well, one simple part of it, because PEF actually, the COVID pandemic actually didn't start in the IDA countries. So it really came over to Europe and the US and then really was affecting these countries. So then it did disperse quite quickly. Now you could go further and say, well, that is naturally the nature of parametric insurance. You choose which kind of scenario you want to cover. And when PEF was designed, that was also under the impression of the Ebola, the Western Africa Ebola outbreak. It was really focused on these scenarios, but it was well, and the World Bank was well aware that there are other scenarios. So that's why PEF actually did not only have the insurance layer, it had a contingency layer. And that was also activated and paid out earlier. And I should add also paid out for other outbreaks. Because, and I guess that's the last big criticism which you could sometimes read in the media. Why is it so much more expensive than just taking a loan, right? Just taking debt. Well, first of all, a loan you have to pay back, and an insurance payout you don't have to pay back. But also given that it was really addressing these different types of scenarios, I think the modeling agents and when it was structured had a probability for a partial payout over the 3-year transaction term of like 40% or something like that. And you did have 3 eligible events over the lifetime of PEF. So COVID was actually only the 3rd eligible event, which then also led to a payout. And these are things, of course, if you dig more into detail, which show that PEF probably did actually work the way it was designed. Does that mean it can be the only way of managing and funding such outbreaks? No, clearly not. And that is really the one pillar of many. But let's not forget also the ex post approach, asking for ex post donor funding, did also not always work particularly well for COVID-19. So in both cases, I guess we can always improve.
Thank you. Yeah, I think that also leads on to a question that actually Danny Kurniawan posted on the Q&A. Because, of course, now on the G20 agenda, member countries agreed to form a new financial intermediary fund. And it has already gathered $1.4 billion commitment among 15 countries. So what are we thinking about how this is going to go? Will it be effective in preparing for any upcoming crisis or pandemic specifically? Who wants to comment on that? Right, maybe we think a bit about that. So then Laura posted the question, actually, are there studies that correlate the cost of preparedness to pandemics when compounded to the climate change crisis. So is there any kind of research that links climate change risk going forward and the cost of pandemics?
I can respond. I mean, there isn't very much, but there should be much more. It's the point I'm trying to make, that these things are, you know, two sides or three sides of the same coin. That metaphor doesn't quite work. That I think it's right to think about those in the same breath. I think more work should be done. I think it's, you know, we've got to overcome this difficulty that we have of not really being able to quantify the returns to investments of this type very, very well. Everyone sort of knows it's important to have a strong health system with plenty of staff and strong supply chains and cold chains and things, but quantifying those benefits is really difficult. But we need to get better at that. I mean, it's a key research interest of my own group here in the Institute, actually, and we're trying to make strides to do that by developing a mechanistic model which, you know, literally connects the implications of having fragility and weakness in the health system and the lack of flexibility to, you know, injurious health outcomes for a population. I think it's a really important question. Thank you to whomever it was that raised it.
Thanks, Tim. So we shall be looking forward to the findings of your research. Sorry, Gunther, want to come in?
No, sorry, I just wanted to add to Laura's question. Maybe the aspect that, yes, there are correlations between climate and pandemic, but they are also not identical. And I give you one example. If you look at climate change, of course, it, for example, changes the habitats of mosquitoes. So as certain types of mosquitoes move up further north, they bring certain diseases along with them. So that is something you clearly see. You see malaria cases in new further northern up countries, which you have seen before. So that aspect does exist, and that is an area where also epidemiological research and papers have been published. Now, certain other aspects, though, have nothing to do with each other. Like if you look at the farming example before, if the way we put many animals together in an open stable, in an open cage, that is also increasing infectious disease risk, but has nothing to do with climate changes. So there are overlaps, but not identical. And coming back to the previous question of having a response fund, I mean, the one thing I would add as a country, I wouldn't have a good answer of 1.4 billion, or what was that the number is the precisely right number, but doing something more than in the past, I think that is clearly desirable. And also the numbers which Andrew did before, right, in terms of economic cost and likelihoods of these. Because we see that whichever mechanisms we have, be it ex post mechanisms and funding often coming delayed, being ex ante mechanisms just simply existing at a very small scale so far, it's not sufficient. And given that the risk is increasing, we need to do more of it. And if I may still lead it back to this public-private partnership approach, which I had the slide up before, and really starting from a small specialty market segment, I would think sometimes naively optimistic, you could always phrase it to discussions with the public sector. Well, here's an approach. Dear government, you've just spent how many billions or trillions of dollars in kind of funding the response or support of the economy and subsidies to help them survive and get over COVID, which Timothy marked before, right, worked much better in the developed economies than in the less developed economies. But then here's a market mechanism which sets the right incentives and signals that you should get repairs, that you should adjust your supply chains or whatever the measures are, which are costly. And you can help that market developing by putting 100 million, 500 million on it. And you don't even need to pay it now, only after the next event when you would fund it anyways. It comes at a positive value for money by default because you come in at market rate. So why would you not do it?
Thanks, Günther.
So maybe just a quick one on that to add to the confusion rather than to eliminate it. I think that the how much you spend and what when we're looking at sort of the interaction between climate change and a pandemic, we're talking about a really uncertain future. And the thing that strikes me about even trying to identify the costs and what was effective in this pandemic versus the next pandemic is that there is so much that we don't know about what the world will look like when that next pandemic occurs. And where I'm going with that is, imagine the counterfactual of what this pandemic would have looked like if we didn't have the very rapid rollout of these new vaccines, right? So that's a technological breakthrough that occurred. Now, I'm not an epidemiologist or a medical person. I don't know exactly when it occurred, except that my limited understanding is it's fairly recent and it was fairly new approach. If we didn't have that, then rather than being in a post-COVID kind of new normal world, we might still be in the throes of the pandemic currently. And similarly, when we're looking forward into the next event, it's not the least bit clear that the next event is just going to be a rerun of the current event. And that's what makes all of this work so difficult, and why I think that in some sense the answer to some of these questions is you really have to push on all fronts in the hope that you happen to have been pushing on the one lever that is going to be particularly effective for the next event that occurs, which is why I like Tim's, let's be flexible, let's be able to respond because we don't know what's happening.
Yeah, great. Thanks, Andrew. And thanks for reminding us that actually vaccines surely is, or investments in vaccines are probably the most cost-effective preparedness tool that we do have, which leads me actually to a question that Neil posted on the chat. Because what he's asking is whether we should be looking to do theoretical cost-benefit calculations that I think without any doubt would show that on a macro level, investments into vaccines and vaccine manufacturing are cost-effective, or whether we should rather be looking at specific packages based on system rationale. So I guess this is more concrete case studies of how exactly we want to structure these investments and whether we have enough information on the effectiveness of different interventions to understand the relative return. Anyone wants to take on that question?
So knowing absolutely the least about the area, I'll try and start off if I can, and that way we can do better. I think that as sort of an economist and looking at this event, we have this wonderful natural experiment. We had effectively the same disease imposed on 280 countries, more or less simultaneously, with, as I've indicated, just hugely different results. And so it seems to me that there's an opportunity to really try and understand better why they were so different. The challenge from an academic or a research point of view is to have decent data to which surround that. There, I think of that graph of what happened in all the US states is really nice, because you do have states with very different economic structures, very different policy responses, very different attitudes towards public intervention. And we can perhaps begin to, at least for this particular event, identify what worked, what didn't work, and what was a really expensive, at least from the economic point of view, but also from the disease point of view, approach by looking at those data. That would be where I would jump in, but that's because I know nothing.
I can have a go at responding to Neil's question as well. I mean, I think the question is, do we have enough information on the effectiveness of different interventions to understand the relative return on investment? I would probably say maybe we don't actually, and we should be trying to get more. The way that Andrew says it, I think it's right. I think there'd be other empirical studies and modelling, theoretical studies to econometric studies to try and tease that out. I'm not sure if it's or should we try to get that information or compare potential investments or look at a systems-based approach? To me, it has to be a systems-based approach. Yeah. So a systems-based approach, but I don't think we have all the answers to hand yet. I don't know, maybe Katharina, you're probably the one who's looked at this much more than me, actually. You might want to say whether you think we have enough information yet as well. That's good to.
Yeah, well, I personally think probably we don't, but yeah, so that's an interesting agenda, I think, going forward. We have 3 minutes now left for our discussion, so I wonder whether it will be interesting to give our 3 panelists the opportunity to make some closing remarks on lessons learned during the panel that we had today, and just some take-home messages for our participants. Thank you. Who wants to start? Günther, you want to start?
And I can start with that one. I guess the one message I would put out there probably is that while it's deeply human to hope to, oh, now COVID is over, hopefully we can sleep again for the next 100 years. I think on whichever level you are, it's really important to understand that the risk is there and is higher than we would hope it to be. So that's really the key important thing, to keep taking care about it, to keep finding ways of institutionalizing risk management processes, so really that we are better prepared for the next one. The tools we have available.
Thanks. Tim? Last words?
Look, thank you for the session. I came into the session really not knowing if the 3 panelists would agree or be on the same page about what the priorities are and so on, but I actually am hearing lots of agreement, which is really interesting and encouraging, even from our different perspectives. So thanks for the session.
Thank you. Andrew, some last words from you.
Sure. So I would just say the response to COVID economically, or the cost of COVID economically, was really large. Okay, 10% of GDP, or if you want just the additional debt repayment every year for the next 30 years to pay for the fiscal response of increasing our debt to GDP ratios by 10 and 20%, those are really large. So you guys who are really at the forefront of dealing with this need to take that in the back of your pen. So when you're talking to funding agencies and everything else, and listen, what we're asking for is a fraction of what you're already paying for not having done it the last time, and to remind them of that, and they'll ignore you, but I really do think that fundamentally, if you look at sort of the economic prospects for the globe in a world where COVID hadn't occurred versus the world that we actually live in, then things would be a lot easier, and that gives us that estimate of how much would it be worth our while. It's the cost of insurance, right? Is the cost of insurance should be the cost of the damages foregone, and that's your estimate of the damages.
Fabulous. Thank you so much, the 3 of you, for a really fascinating, unusual session on the economics of pandemic preparedness. We now have a 10-minute break. We will reconvene at 12:25 UK time. And in the meantime, we will show a short video on the Jameel Institute. Session 2 will be moderated by Marisa Meraldo, and that's on behavior. So please do stay online, keep your link open, and we will meet again in 10 minutes. Thank you.
Bye-bye. Thank you.
Thank you.
Thank you.
The Institute is founded to respond to the most critical health threats the world is facing.
I think of the Institute as a hub within a hub. And so, of course, we have a lot of scientific expertise within the Institute, but we also benefit from the partnerships that we have with the college more broadly, with the expertise that we have, but also the collaborations across the world.
There's
diverse team with a single purpose is what sets Jameel Institute apart.
Interdisciplinary. We're not a group of economists or a group of epidemiologists or a group of healthcare system modelers. We're all of those things put together.
The Jameel Institute are experts in a wide range of areas, not just infectious disease epidemiology, but also non-communicable diseases, environmental health, and health economics.
Using modern data analytics and the tools associated with that to find optimal solutions with partners to some of those threats, both emergencies like pandemics, but also the diseases which affect humanity for longer time periods.
So far we've absolutely done that during the COVID-19 pandemic, and what's exciting is what we now do next.
Well, I think the Institute was on the forefront in what has actually been a transformation in the way we do population health. The pandemic forced all of us to be more responsive, to be faster, to develop new methods of doing research, of communicating it, and really ultimately to guide decisions and responses.
We were among the first institutes worldwide to recognise the scale of threat and indeed quantify what risk COVID-19 posed to the world. And so we've been working throughout with governments around the world, with partners in both academia and in the public sector and private sectors, to use the tools we develop of mathematical modelling, data analytics, to both understand the spread of the virus, but also inform control measures and the application of things like vaccines.
Having a team of people that have been so closely involved with the work throughout this period means that we can apply the lessons we've learned here to future disease outbreaks and make sure that the information we've gained from this pandemic is appropriately applied in our future responses.
So as we are hopefully beginning to move out of the immediate COVID crisis, we will focus our energy on, of course, still outbreak response. I mean, there are other diseases that are continuously threatening population health, such as Ebola. But we will be moving more towards pandemic preparedness, for which we understand as something very broad, encompassing in improving the resilience of populations, particularly the most vulnerable populations, to deal with health emergencies, be they epidemics or other disasters.
Our team, particularly working on infectious diseases, but also looking at different changes in extreme weather, will really play a key role in how we as a society and a world move forward.
I enjoy the science, but also I think something that's very specific to what this institute does is translating the science into something that is really useful to improve the quality of life of people worldwide. So yes, I really enjoy what I do, and I hope I continue doing it for a long time.